Hello everyone, welcome to ENT student. Today we are going to discuss about tinnitus, which is one of the ear complaint. History of presenting illness in a patient with tinnitus or ringing sensation in the ear. First of all, we should ask the patient about mode of onset, which is either sudden or gradual in onset. Tinnitus may be unilateral or bilateral. Duration of the tinnitus, the progression of the tinnitus, which is either slow, rapid, increasing, declining or constant. If it is continuous or intermittent type, aggravating and relieving factors of the tinnitus, and we should also look into the negative history and the associated factors. Perception of auditory sensation, sound ringing or noise with no external stimuli is called as tinnitus. Tinnitus is classified into four types: subjective tinnitus, objective tinnitus, pulsatile tinnitus and non-pulsatile tinnitus. Subjective tinnitus is the most common type seen in patients, and it is only perceived of the patient, mainly due to psychogenic or functional. Objective tinnitus is perceived both by the examiner and the patient. It is usually seen in chronic contraction of the tympanic muscles, live insects in the ear, clicking TM joint. Pulsatile tinnitus is of non-continuous type and is due to idiopathic, non-vascular causes and vascular changes. Non-vascular causes are myoclonus, neoplasms and TM joint disease. Vascular disease changes such as hypertension, atherosclerosis, otosclerosis, glomus tumor, anemia, pregnancy and exercise. Non-pulsatile tinnitus is of continuous type and it may or may not be associated with hearing loss. Continuous type with hearing loss is usually seen in wax, foreign body, otitis media, otosclerosis, noise exposure, Meniere's disease and acoustic neuroma. Continuous type without hearing loss is seen in psychogenic, idiopathic and in migraine. Site of the tinnitus is usually in head or ear. It is of unilateral or bilateral type. Duration of the tinnitus may be short and long. If it is short, it is usually seen in middle ear diseases. If it is long, it is usually seen in inner ear diseases like ototoxicity and Meniere's disease. Severity of the ringing sensation in the ear should be asked. If it is a fluctuant in progression, it is usually seen in Meniere's disease. Past history is important in case of previous head injury, ear surgery, drug intake and noise exposure. Aggravating and relieving factors should be asked. If it is aggravated by smoking, it is most likely to be inner ear diseases. If it is aggravated by yawning or blowing, it is associated with ET dysfunction. If it is relieved by putting pressure on the side of the neck, the most likely cause is vascular. It may or may not be associated with hearing loss. Thank you.